I'm Rip Esselstyn, and you're listening to the Plan Strong podcast. I can't think of a better way to close out National Heart Health Month than with a man whose legacy and body of work has influenced me over the years and saved countless lives. Today, my father, Dr. Caldwell B. Esselstyn, or who I affectionately call Essie, is back for his 6th appearance on the Plan Strong podcast, and he's going to share with us the many ways that he has shown reversal of heart disease through the power of a whole food, plant-based diet. We'll have the heartwarming news right after this message from Plan Strong. It's not too late if you'd like to join us for our upcoming retreat in magical Sedona, Arizona. It's April 6th to the 11th for a week of Plan Strong buffets, epic hikes, morning yoga, and insightful talks from leaders in the plant-based movement. If you want more details, visit livePlanstrong.com and then join me for an incredible experience with the Plan Strong team. More good news. For just a few more days, we have extended the Plan Strong Meal Planner New Year promotion that's good for $20 off the annual membership with the code KALE20. That's KALE and then the numbers 20. With this promo, the annual membership is just $79, which comes out to just $1.52 a week. This small investment provides access to over 2,000 recipes, all kinds of tips for success, a course on stress-free meal planning, one-on-one coaching, along with the coaching program, and tools to support the Plan Strong lifestyle. Visit liveplanstrong.com and then click on the meal planner and then use the code KALE20 to redeem this offer. I know that you've heard me say that I am literally standing on the shoulders of giants, and I am. For decades now, my father, along with the likes of Dr. Dean Ornish, Dr. John McDougall, Dr. Joel Furman, T. Colin Campbell, and Dr. Michael Clapper, amongst others, have been unwavering in their message that a whole food, plant-based diet can prevent and even reverse heart disease. And they haven't just been proclaiming this with zero data. Rigorous evidence-based research and clinical trials have shown this to be true, and that is why I'm proud to carry the legacy of my father's work. Today, I welcome Essie back for a casual conversation as he shares multiple patient stories and the many measures that he has shown in patients of cardiovascular disease reversal. If you want to follow along with visuals and graphics, I would highly encourage you to watch it via YouTube. I'll put that link in the show notes for you, and I'll also link up to a presentation on this very topic that he did live for us a few years back. I cannot think of a better way to close out Heart Health Month than knowing that there is hope. You can get that beautiful heart pumping, loud and proud, and the great news is, it is never too late to start. Let's welcome Dr. Caldwell B. Esselstyn Jr. Essie, so wonderful to see you for your 1, 2, 3, 4, 5. You know, this is your 6th time on the Plan Strong podcast.
There you go.
Yeah. And just when you think that you've said it all, we realize that you haven't. And so this month, February, is Heart Healthy Month. Yep. And we're celebrating all things heart healthy. We had your friend from Montefiore, Dr. Robert Osfeld, on the podcast. We had Dr. Columbus Batiste on the podcast.
Great.
We had Dr. Joel Kahn.
Sure.
And to kind of round things up and kind of bring it home, we've got the man himself, Dr. Caldwell B. Esselstyn Jr. So thank you for joining us. So you and I today And Ann, make a peek because I want to wish you both happy Valentine's Day, right?
No,
I mean,
from here.
Ann, just make a blaze. Come by so everybody can just see your streaking face. We can't see you.
I kept my mind.
Hi, Ann. Hi. And I love that blue.
Oh, thank you, Rip. I love it when you wear blue too.
I know. I'm wearing gray. So, Essie, what I would love to do today, and for those that are not aware, let me just kind of give a little summary of your current position at the Cleveland Clinic, where you've been since, 1960? You've been at the Cleveland Clinic in some form, right?
61.
1961. Yeah, I exaggerated.
Years, yeah.
So you're currently the director of the Cardiovascular Disease Prevention and Reversal Program at the Cleveland Clinic Wellness Institute. Would you agree with all that?
Actually, recently they changed the title of the Center of Prevention and Wellness.
Okay, Center of Prevention and Wellness. I guess that'll work.
Yeah.
And so what I want to do is I'd love for us today to focus in on the 10 ways over the course since you've been doing this since 1984, doing this research to show that heart disease is not only preventable, but it's also reversible. Let's talk about the 10 ways that you've been able to document that coronary artery disease is, in fact, preventable and reversible. Does that sound good to you?
Yeah, let's do it. You have to help me out if I forget one.
Okay. Well, you got it. Unfortunately, I don't have the list of 10 in front of me, but I have some of them that I can remember.
No, I have 9. I'm sure we'll make it all right.
Oh, okay.
I'd like to start first of all with saying that I think a thing that's so profound about knowing cardiovascular disease is to realize that everybody on the planet Earth who has cardiovascular disease at one time had no disease. Would you agree?
Absolutely.
In other words, what we really have to examine is what do people do to themselves from a position of having absolutely wonderfully clean arteries to have them begin to silt up, fill up with blockages and plaque. Why does that happen? For instance, and we have to be aware that when you think about it, the medical profession has a serious black eye about cardiovascular disease, because we have known for over 100 years that there are multiple cultures on this planet Earth where cardiovascular disease historically was really relatively non-existent. For instance, rural China, Central Africa, the Tarahumara Indians in northern Mexico, Okinawa, and the Papua Highlands in New Guinea. No heart disease. Why? They thrive on whole foods, plant-based nutrition. But where the black eye occurs, think about it. The American Heart Association was formed in 1924, okay? Now, that means that's quite a few years. As a matter of fact, that's 100 years that they've been watching all these other societies without any heart disease, and what we've ended up, sadly, in Western civilization, New Zealand, Australia, right? And the United States and Europe, South Africa, we don't treat the causation of the disease. That's the black eye. What do? We use drugs, we use stents, we use bypasses, not one of which has one single solitary thing whatsoever to do with the causation of the disease.
Isn't that interesting? Yeah. Well, so it sounds like a bit of a, would you call it a charade? What would you call it? Is it just kind of misguided emphasis on what to do?
There's a combination of things. One is that cardiovascular participants or physicians in medical school have no nutrition, and they have none really of substance in their postgraduate training. So and they really never made it a science in their instruction about these nations where the disease is non-existent.
Mm.
There's another wrinkle that sadly has entered this, and I have always hated to mention it, but I think in reality we have to, and that is, what do you suppose you would get in the way of remuneration if you talk to a patient about Brussels sprouts and broccoli compared to the remuneration there would be if you did a quadruple bypass or stents or spent a time on drugs? So there is a financial conflict in methods of therapy, because what I've been doing for years is that many of the patients that come to see me are those who have previously been told that they have to have a stent or a bypass, and truly they don't have to have it, but the person who has been counseling them has no awareness or no training in this.
Mm-hmm. Mm-hmm. Well, and to your understanding, what is a stent? The average stent run these days is about 50 to 75,000.
Oh, I'm sure.
And then an open heart bypass is probably what, 125K?
Well, more than that, I would think.
Okay. Yeah. Okay. As opposed to Brussels sprouts and steel cut oats, that'll run you, a couple bucks. Okay. So anything else that you want to say before you dive into the 9 or 10 ways that you've been shown to reverse heart disease?
No, I think that's really I want to be sure that people understand that there are a number of physicians who are aware of our program of arrest and reversal of disease. And sometimes I'll get a call from one of them saying, Dr. Esselstyn, I believe in the science that you've recorded, but I just am not able to get my patients to do that. And I said, well, then I will ask them usually, well, can you tell me how much time do you spend with these patients? And the response usually is, well, Dr. Esselstyn, you have to know that I'm a very busy physician. And if I can give these patients 10 minutes, that's about it. Well, if you're going to, and there is a rather profound lifestyle change that occurs when you're asking patients to commit to whole food, plant-based nutrition and give up consuming animal foods. And if you're going to have a patient make a significant lifestyle change, you've got to show a patient respect. The only way that I know to really give a patient respect is to give more time. So on our present format that we have in counseling patients, there are 2 main items. One, there's a 5-hour session that the patients are going to learn all about how they have created their disease and precisely how we want to empower them as the locus of control to halt and reverse their disease. And the other part of the commitment is that I'm afraid I have to say I'm a little bit old-fashioned, and that every patient who comes to our seminar, my secretary will give me their phone numbers so that 2 weeks before they come, I'm able to call them and have an opportunity to get my arms around their story, and at the same time permit them to ask questions of me, so that coming to the seminar, we have a strong platform from which we can all move forward. And that's why in our first study in our first review of this approach, which was published in the Journal of Family Practice in 2014, with some 198 patients, was interesting that close to 90% were committed to our program in its follow-up. And of those who were committed, none of them in that follow-up period had either a heart attack, stroke, or death.
So meaning when you say committed, meaning they were adherent to the tenets of the program.
That's correct.
Right. Right. Yeah, that's phenomenal results. And to have 90%, 10% recidivism, 90% compliance is kind of unheard of.
The reason that happens is that the reason my program succeeds where others may fail, nobody else is as mean as I am.
Yeah.
And I mean attention to detail. Yeah.
Yeah. Yeah. All right. Well, let's dive in. Let's dive into the 10 ways that you've been able to show the reversal of heart disease. What do you want to start with? The big mothership, the coronary angiogram?
Why not?
All right. So what have you been able to do with the coronary angiogram?
The angiogram is as a follow-up is really rather challenging. And I will let me just at the very outset say that I do not like to ever think about using an angiogram as a follow-up to show reversal of disease, because people can die getting an angiogram. When you thread that catheter up into an artery to the heart, and especially if you're doing a stent or something, because the heart was never designed to accept these catheters in, especially into the vessel. And then patients can develop really a fatal arrhythmia. And I'm aware of patients, when we were first starting our study back in '85, I was aware of patients who had died. And so as a follow-up to how they're doing after they've been on the program, there have been some angiograms that have been done where it has been insisted by the patient, or in our very first group, there were expert cardiologists who had sent me these patients, and they were as insistent as were the original patients in saying that they wanted to know what was happening. So, and that group did fine. There was nobody got seriously ill, and it gave us the information that we wanted. But subsequent to that, I've now treated, at last count, it was a little over 1,800 patients this way. And my preferred way of follow-up is, as I said, not an angiogram, but it can be a echo stress test, which has no radiation and has no contrast that might injure the kidney. So a echo stress test is my preferred method, especially when you see that usually within 10 or 12 months after starting it, if it was abnormal at the start, it'll now be markedly improved or back to normal. But I want to come back to an angiogram for a minute, because there are some people who have been skeptical when I published the original works showing the angiograms. I should say that every one of the angiograms from that original group was reviewed in the Cleveland Clinic Angiography Core Laboratory in triplicate by senior technicians that do this all the time for national medical studies. So there was absolutely rock solid accuracy in the way they did this.
And for people that don't know what an angiogram is, will you explain how it's kind of like an X-ray of the disease?
Nowadays, originally a catheter was introduced through the groin up into the aorta, and then up into the right and left artery of the heart, and then contrast was injected, and then an X-ray was taken, and you could see whether there were blockages of significance in the vessel.
How many times would you say you have been able to show reversal through before and after angiograms?
Oh, on multiple occasions, yeah. There are at least 5 or 6 that we've got, and that's it's really quite spectacular. Some people will often say, "How long does it take to have that happen?" Well, I can give you evidence that it varies between 1 or 2 or 3 years to get it all the way. Some plaques that are made up of fibrosis and scar and calcification,
Yeah.
actually may be very stubborn. And although they don't go away, it's interesting that even those patients can get back to full activity of daily living without restriction. And I should make a further comment on that. Actually, there was a wonderful slide that actually came from you, Rip, several years ago. That shows a heart, and a contrast has been injected into the arteries. So you see all the main arteries, which are on the top of the heart, and where do they go? They all dive eventually in to the heart muscle, where they bifurcate and join other arteries. So you have this amazing constellation of thousands and thousands of interconnected intramuscular arteries. Now, the reason this is important is the following. We learned some time ago that when patients who come to us with chest pain or angina, they will actually sometimes within 2, 4, 6, 8, or 10 days of starting our program, their angina will either markedly diminish or disappear. And there's another study that we're going to talk about shortly called a PET scan. But my fascination was, how in the world was it that I just knew that we couldn't get rid of a blockage within 2 to 3 days. So I called down to Rodriguez, who actually is the chairman of cardiovascular pathology at the Cleveland Clinic. He looks at the heart of 200 patients who come through autopsy. And I asked him, how often do you ever see a plaque or blockage? The thing that was fascinating, when Rodriguez said that there never had any plaque then I had the answer as to why they were getting better within 2, 4, or 6 days. Why is that? Because when we first see these patients, they are absolutely, their endothelial cells are so injured, they are barely making any nitric oxide, which is the great dilator of the blood, of the arteries to the heart. And at the same time, when we first see these patients, they're so sick, their endothelial cells, which normally make this wonderful vessel dilator, they are now your enemy. They're making 2 molecules of endothelin and thromboxane, which are vasoconstrictors. So what happens is, obviously, not only are those 3 main arteries to the heart constricted, but all those thousands upon thousands of interconnecting intramuscular arteries are blocked, not by blockage of plaque buildup, but they're blocking because they are vasoconstricted because of these 2 molecules of endothelin and thromboxane. But the exciting thing is, as soon as you get these patients to convert, they start once again making this nitric oxide vasodilator on their own. And at the same time, they stop making the vasoconstrictor. What does that translate to? That means that within 2, 4, or 6 days, all those thousands upon thousands of intramuscular arteries that are sort of clamped down and narrowed open up. You recall in Poiseuille's law of flow through the hollow viscous is related to the 4th power of the radius. Translation, tiny increase in diameter, a huge increase in blood flow.
Yeah. All right. Fantastic. So you want to move on? So that's the angiogram.
Yep.
What do you want to move on to the stress test or the PET rubidium scan? What do you want to talk about?
Well, let's take the stress test. That's often a key for the cardiologist when he's first beginning to evaluate a patient where it's kind of iffy whether he should really go ahead and get a lot of cardiology tests or not. But it's a stress echo stress test is safe, easily performed, And it also can pick up or help pick up if so you don't have to do an angiogram or something more extensive. It can pick up whether or not the heart is actually suffering from a deprivation of its normal supply of oxygen and blood and nutrients. Because what happens on a stress test, you're looking at the heart beating, and you're looking at how well the wall is constricting. And if somebody has a deprivation of blood flow to a portion of the heart, you will see that at rest, it seems to be doing just fine. Mm-hmm. But then you put the patient under a little stress echo, and at stress, because of the narrowing of blood vessels, there is insufficient blood supply, so that muscle cannot constrict as it normally should, or as it did when the patient was at rest. And so you can then identify heart segments that are being poorly deprived with blood, and then it may indicate that you should do some further testing to clarify just how significant is the blockage. That's the stress test.
And
stress echo, yeah.
You're right. And you've had great success with that?
Oh, it's exciting because that's the safest way for the patient to see whether our program is working as far as they're concerned. Because let's say that they start at baseline and they fail their stress test, and if they repeat that at 10 or 11 months, it'll either be markedly improved or back to normal.
And so you mentioned, like with the coronary angiogram, that's usually 1, 2, 3 years. It's all dependent. I remember seeing one of a patient from Florida where after 6 months, there was a reduction from about 100% to 80% blockage.
You're absolutely right. It was a reduction at 6 months, but he actually had to go on for another year and a half to get it. It all went away, was profound. But while you're on that, now I want to come back to a patient that I've after all these years, this one was really unique. From Seattle, this is a gentleman who in September. It's very important to follow these dates because it actually portrays precisely the point that I'm trying to make. So in September of 2023, he began to get discomfort in his abdomen when he was eating. And it wasn't much. And he kind of put up with it and thought it was just he had gas or something. And now in December, though, of 2023, it began to get severe enough that he made some changes in his diet. Well, that didn't seem to work. So it was still in December of 2023, on the 26th, just after Christmas, he had some further changes in his diet. And then suddenly now we went to 2024 in January, about a week or two later, he made some changes and he gave me a call. And he gave me a call because in that first week of January, he had imaging done of his vessels in his abdomen and his superior mesenteric artery, which supplies all the blood supply to your small intestine. His superior mesenteric artery had a 75% blockage.
Wow.
And that's when that's the first week in January. 2.5, 3 weeks later, he noticed that his pain was not only improved, but the pain was gone. So, believe it or not, now this is after his first imaging that was done in early January. Now, the first week in February, this is 4 weeks after being on treatment, he had another imaging, and the area, and the same radiologist, when they imaged the blockage in the superior mesenteric artery, had completely 100% gone.
4 weeks. That seems hard to believe. What do you attribute that to?
Well, and no, but I want to stay on that a little because I don't think I ever would have believed that until it just had worked out that way. To think about it, in that sort of situation, when the plaque or the blockage is made up of inflammation, fat, and cholesterol, there's nothing there that's rock solid. So it's the cellular constituents of that blockage are really prone to reversal when the patients do it as accurately as this patient did from Seattle. And so when the tides are right, when the plaque is made up of inflammation, fat, and cholesterol, and the patients really commit, it's really quite exciting. So actually, we have a range of reversal, sometimes as soon as 3 weeks. Other times it may take 3.5 years.
Right. Wow. Well, so speaking of 3.5 weeks, I've seen your PET rubidium scans, which is the third way that I think you've documented reversal.
That's
with
right.
Just as little as 2 weeks, where you have documented amazing increased blood flow to the heart.
Yeah, that goes back to what we talked about in my early amendment. When you change that way, back comes the nitric oxide back, and you get rid of the endothelial and thromboxane, which are the vasoconstrictors. And that's why you see this wonderful change in the PET scan within a few weeks. Yeah.
Yeah, I mean, I've seen your PET rubidium scans, and you have photos of them in your book, Prevent and Reverse Heart Disease.
Right.
But you've got many of these before and afters, and it is alarming the amount of increased blood flow that happens literally in just 2 weeks. And I think you do a combination of low dose statin, and then of course the whole food plant-based diet. Is that correct?
Yeah, except there are many patients that we see who, long before they ever heard of me, found out that they were unable to take a statin. Either there was just severe muscle pain, or it was injuring their liver, or gave them diabetes or brain fog. And yet, as you look in the book, two of our most profound examples of disease reversal occurred in people who could not take a statin.
Yeah.
Yeah.
Okay. So we started with coronary angiograms, then stress tests, PET rubidium, and then what's the next word after PET rubidium? Something.
PET rubidium dipyridamol.
Dipyridamol scans. Yeah. And then I know I've heard you talk a bunch about the carotid ultrasound.
Yeah, that's really something that an alert physician, every time they find something wrong with the heart, they'll be sure to put their stethoscope over the neck to see if they hear a bruit. A bruit is a little sound that you will hear when the blood is rushing over a plaque and is turbulent, and it gives an indication. Or even if you don't hear a bruit, it's probably nice to check on the carotid artery as well, because there's no satisfaction in having a stroke. So it really is very easy to check. And I think the way to demonstrate how that can work in reversal is a patient actually I had from Canada. And it was interesting that at age 44, this gentleman had a stroke. All right. And he actually had recovered extremely well. He was 44 years old. And believe it or not, at the same time he had such severe angina, they found a courageous physician, a surgeon in Toronto, who actually agreed to operate on him for his heart. And he had a wonderful result until he was now about 69 years of age. And he was now, again, in trouble. He was obese. He had angina. He had developed diabetes. He had erectile dysfunction. And when they checked his one remaining carotid, it was now 90% blocked. Now, of all things to have happen at this time, his 37-year-old daughter had a heart attack. And during her convalescence, she found a book, Prevent and Reverse Heart Disease, and said, Pop, we got to do this together. They did. It was a year later that I first heard about the couple. And at this time, he said, Dr. Esselstyn, I wrote you this letter because I wanted to thank you for writing the book. Since my daughter and I have started the program, I have lost 40 pounds. All my angina has gone away. My diabetes has gone away. My erectile dysfunction has gone away. And my one remaining carotid artery, which was 90% blocked when I started this program, it is now 67% blocked. That was really kind of a provocative, exciting story.
Yeah.
Now, the next one we wanted to look at is pulse.
Before you go to pulse volume, can I just ask you on the carotid artery ultrasounds? So what kind of so that was a 90 to 67% reduction in a year.
Yeah.
Have you heard about greater reductions?
Oh yeah, we've had some patients where it's just simply gone. It's gone away.
And what are we talking? Again, 6 months to a year to 2 years on the carotid?
The one I can recall right now is a year. Yeah.
Mm-hmm. And do those arteries have a tendency? Can they fill up with the calcium as well?
Yes.
Yeah. Okay. All right. Great. So next thing you said you wanted to visit was pulse volume. What's that?
Well, that's interesting. I'm going to take a patient example. A 54-year-old gentleman with heart disease who also was getting claudication in his right calf. Claudication, as you know, is pain from a decreased blood supply. And he noticed this claudication in his right calf when he was crossing the Skyway to my office. He had to stop 5 times. But when he would stop, the claudication would go away. Then he could resume walking. But I was so focused on his heart, I sort of forgot about his leg until he'd been with us about 10 months. And one visit in my office, he said, Dr. Esselstyn, do you recall when I first started seeing you, I had to stop 5 times in crossing the Skyway to your office? And I said, yes. And he said, in the last month, the pain got less, and now it's completely gone away. And I said, well, Don, you go to the vascular, because at the time that we had first seen him, when we had the diagnosis of claudication, we did a pulse volume on it, which is an evaluation of the blood supply at the ankle of that leg. So we went back and repeated that now 10 months later when his pain was gone, and it was absolutely, I don't have the graph here, but it was doubled. It was absolutely doubled. And this was shortly after we started the study. So we now suddenly had in our study absolutely rock solid, irrefutable, hard data.
Yeah.
That we could absolutely halt and reverse disease with food and food alone. And somebody's going to say, well, wait a minute. What about the statin drugs? Well, this was 1986 before the statin drugs were even invented. So it really confirmed the absolute power of whole plant-based nutrition.
Well, and wasn't there a woman that worked, a physician at the clinic? Was it Bernadine Healy that said that, Essie, you've just shown proof of concept?
Yeah.
Is that right?
Right.
So pulse volume, wonderful. And what we'll try and do here for the listener is we'll try and insert that pulse volume graph that you did of that patient so they can see exactly what you're talking about. Yeah. So you also mentioned with him and some other people already, angina, the reduction or elimination of angina. And you also mentioned the term claudication. You want to talk about those two things at all?
Well, I think if we looked at all three, angina, claudication, and erectile dysfunction,
Mm.
these are all symptoms that patients will have when they have deprivation of a blood supply to a certain organ system. If it's good, obviously, if it's to the heart, deprivation of adequate blood supply will result in symptoms of heart pain, or which we call angina. When the same thing happens to the leg, it's called claudication. And when the same thing happens to the blood supply to the penis, that's erectile dysfunction. And the exciting thing is that all three of those symptoms can be reversed with whole food plant-based nutrition. There's one final measure that I'd like to mention, and that's ejection fraction.
Oh.
This isn't so much necessarily that somebody feels as a symptom, although it can be part of angina. But the ejection fraction is a measurement that the cardiologist will make either during an angiogram or during an ultrasound. And it is a measure of the capacity of the left ventricle to squeeze. How hard does it squeeze? And anything over 50% is normal. And I'm happy to say that we've had a number of patients with heart failure, because when you get much below 45%, that's beginning to be defined as congestive heart failure. But some of those actually can be restored to normal when you can restore enough of the blood supply so the heart begins to begin squeezing as it should.
Mm-hmm. Mm-hmm. No, that's super exciting. I think I've told you about the story of a gentleman who came to me. I referred him to you. He was a coffee owner in Costa Rica, and he weighed 420 pounds. And after following your program to the letter and probably doing 8 to 10, eating 8 to 10 servings of green leafies every single day, his ejection fraction went back to 100%. I think it was at 10% at one point, and he and his cardiologist were talking about a potential heart transplant, and he was down now 250 pounds, and just it's miraculous what he was able to do, just with the power of food. So that's really the 9 then, right? And just for a quick kind of review, tell me if I missed anything. So coronary angiogram, stress test, PET rubidium scan, carotid ultrasound, pulse volume, angina, claudication, erectile dysfunction, and then you just said the last one, ejection fraction.
Yep.
And then, it's funny. So I had Dr. Robert Osfeld on the first week of February on the podcast, and he refers to the standard American diet as the erectile dysfunction starter kit.
That's excellent.
Yeah. And so, I mean, from your vantage point, what is it? Let's just talk about, ED, because I know you say that you've had lots of patients that have had erectile dysfunction and have turned that around.
Oh yeah. No question.
And then they're wondering if they should be writing you another check.
Right. Well, the thing that I think probably Dr. Robert Osfeld emphasizes this as well, that when you think about it, since the penile artery is so much smaller than the coronary artery, that not infrequently, long before the patient will have a manifestation of heart disease, they may experience erectile dysfunction. It's sort of like the canary in the coal mine, because once you have erectile dysfunction, that's the first tip off that you're beginning to acquire a significant heart disease, enough to give you these symptoms. And it won't be much longer down the line. Then as those symptoms increase, it'll begin to be enough to block off the arteries to the heart. So it's key to, as a risk factor, almost, if somebody comes and is complaining of erectile dysfunction, you want to be sure to check out their heart.
You know, what's interesting too is that in the male anatomy, and I remember when I was doing my research for one of my books, and I wrote about this, but the area of the male anatomy that has more endothelial cells per square inch than any other part is the penis.
Right.
So, not surprising that can rebound in pretty short order when you're eating right. Let me ask you this before we have to go. In your opinion, is it ever too late to bring the endothelial cells back to life? Have you ever so trashed them sufficiently that you can't do that?
No, I think let me use another patient example. The oldest patient that I ever had start our program was 87 years of age. And he had been told that he had to have bypass surgery, but he was convinced that as frail he was at 87, that the bypass operation would kill him. So he wanted to go plant-based. And every year he'd give us a phone call to let us know how he was progressing. 2 years ago when he called, he didn't ask for me. He asked, after I answered the phone, he asked for Ann. The reason he asked for Ann was he wanted some recipes, a whole bunch of them. And because he was having a party. And Ann asked, well, what was the special occasion? He said, well, he was celebrating his 100th birthday.
Yeah.
Last year, when we got a phone call from him, he wanted to be sure that we knew that he was now 101. And this year, when we got his phone call, he wanted to be sure that we knew that he was now 102. Wow.
So he's been a patient of yours and following the program for over 14 years.
That's right.
Wow. Since he was 87. How's he holding up?
He's amazing. He's amazing. Wow.
And he actually had full-blown heart disease to the point to where they wanted to do bypass surgery.
That's right.
Man, isn't that something else? Let me ask you one more question before we got to go, and that is, explain to the audience, I think it bears repeating, why you're such a stickler with no added oils.
Well, what we're trying to do with patients who have coronary artery disease, think of it as the following. You have all these wonderful little endothelial cells that are lining the inside of the artery, and they produce a magic molecule of gas called nitric oxide. And nitric oxide has a stream of wonderful functions that all have to do with keeping your arteries clean and having them work properly. So what happens is when you eat the Western diet, you progressively destroy the capacity of your endothelial cells to make sufficient nitric oxide to protect you. And when you run short on nitric oxide, now you begin to get buildup of these blockages and plaque. Think of it this way. Think of coronary artery disease, heart disease, cardiovascular disease as a nitric oxide deficiency disease. And what we strive for in all of our therapy is to have the patients increase their production of nitric oxide for protecting their endothelial cells, and at the same time giving themselves a daily dose of nitric oxide when they eat green leafy vegetables 6 times a day.
So what is it about the oil? The oil kind of disrupts.
Yeah, the oil is part of the inflammation and the destruction of the endothelial cell.
So with your patients, then your heart disease patients, you don't want them to have a thimbleful. Is that correct?
Oh, absolutely. Not even a wisp.
And just as a cautionary tale, you had, tell the story of one of your patients that started introducing it back into their diet and what happened.
Oh, immediately, it doesn't take long. They suddenly begin to find out, especially the ones that have angina, that their chest pain has recurred. And they, with their little, feeling very chagrined, they'll call us back and say, Dr. Esselstyn, I've screwed up. And I said, well, let's just show you how quickly you can restore this again. Get back on the bandwagon, not a drop of oil of any kind, any source, anytime, any place.
Mm-hmm. Mm-hmm. Well,
That story.
what did Ann just chime in there? Can you remember?
Another patient's story.
Yeah. Well, we got time if you want to share it.
I don't remember it.
The guy was sick, and then he did his wife and I.
Ann, are you there?
Yes.
Oh yes, no, there was one. I do recall one patient who had been doing very well, and he was still having angina, and we got to take a careful history, and he said, "Gosh, I'm following your program so carefully, and my wife and I have heard about how important it is to have olive oil, and we make it sure that we have it at every meal." And I said, Jesus, let's see if we can't absolutely get rid of it at every meal and see what happens. And sure enough,
Yeah,
all of his pain disappeared.
yeah. I guess he didn't get the memo on the oil somehow or another.
Right.
Well, listen, that's awesome. I mean, love how you are. You've been such a, some people say you're a taskmaster. You just have a system that's tried and proven, and you've been at it since what, 1984. So is this the longest running study on the reversal of heart disease ever? Is that fair to say?
Well, I don't know. I wouldn't want to go that far, because somewhere in the weeds, there are other people who are tipping this way. Certainly, I have to congratulate my friend Dean Ornish. He and I apparently started about the same time, and Dean actually was more courageous than I was, and he published sooner than I did.
Mm-hmm.
But I think the thing to remember is that we're both really focusing on the absolute value of whole food, plant-based nutrition. And the more people and more physicians that we can have develop an understanding of this and commit to it, it's going to really be quite exciting.
Yeah. And can you come back for goodbye here?
Yeah. Hi. Bye.
Ann, I can see your right eye. It's so fantastic to see you guys. Thanks for coming back on the Plant Strong podcast, Essie. You both, I wish you happy Valentine's. I hope you'll be my Valentine. And I'll call you later tonight, all right?
Let's do it.
Wrap.
Love you.
Bye. Happy birthday, too.
Yeah, hey, give me a Plant Strong virtual fist bump on the way out. Ready?
Let's do it.
Boom. Plant Strong. Thank you, Essie, for your tireless efforts to share this research. As I mentioned in the intro, I'll have a couple of links in the show notes if any of you want to watch the presentation via YouTube, which features all kinds of great graphical representations of the items that he discussed today. And I'd be remiss if I didn't give a huge plug for his groundbreaking book, Prevent and Reverse Heart Disease, the revolutionary, scientifically proven, nutrition-based cure, along with the Prevent and Reverse Heart Disease cookbook that was written by my mother, Ann Esselstyn, and my sister, Jane Esselstyn. From my family to yours, thanks for filling our hearts with your love and your encouragement. We appreciate you and continue to wish you happiness and health. Until next week, as always, keep it Plant Strong. The Plant Strong podcast team includes Carrie Barrett, Lori Kordowich, and Amy Mackey. If you like what you hear, do us a favor and share the show with your friends and loved ones. You can always leave a 5-star rating and review on Apple Podcasts or Spotify. And while you're there, make sure to hit that follow button so that you never miss an episode. As always, this and every episode is dedicated to my parents, Dr. Caldwell B. Esselstyn Jr. and Ann Cryle Esselstyn. Thanks so much for listening.